President Cavaco Silva and Prime Minister José Sócrates of the Portuguese Republic, Dr. Lenore Beleza, President, trustees and directors of the Champalimaud Foundation, Mrs. Maria Luisa Champalimaud, family and friends of the Foundation, distinguished colleagues and guests. I would like to begin by congratulating the officers and directors of the Champalimaud Foundation for first having established the António Champalimaud Science Award and for having chosen blindness prevention and vision research as its focus. 40 million people are blind in the world. Most of them live in the poorest communities of the poorest countries. This year, the inaugural Champalimaud Vision Science Award recognizes outstanding efforts in the prevention and cure of avoidable blindness in disadvantaged communities. Next year, the award will recognize outstanding research in our understanding of vision and the treatment and prevention of vision-disabling diseases. I have no doubt that the Champalimaud Vision Science Award will soon be recognized as the premier honor in the field of vision research and blindness prevention. I would like to personally thank the Champalimaud Foundation for having given me the honor and the opportunity of presiding over the inaugural selection jury. I can attest to the high quality of this year's many nominations. These included, as you've heard in the wonderful video, NGOs working around the world like Helen Keller International, uniquely successful multinational regional collaborations like the African Program on Onchopsychiatrists Control, and innovative indigenous programs like the Aravind Eye Care System, this year's laureate. The Aravind Eye Care System was founded in 1976 to begin to address the enormous problem of cataract blindness in southern India. Blindness that existed solely because poor rural people lacked financial and geographic access to high-quality cataract surgical services. Aravind was driven to inspire and share, but also to innovate and stimulate. It brought a rigorous systems approach to identifying and overcoming the obstacles to cataract surgery. It was soon recognized that the type of inexpensive surgery then offered the poor, which omitted the use of expensive intraocular lenses, provided inadequate visual rehabilitation to even motivate the poor to seek surgery in the first place. By establishing a manufacturing facility for inexpensive intraocular lenses, Aravind dramatically improved postoperative vision and increased the demand for cataract services while drastically reducing the costs of surgery. To deal with the lack of sufficient numbers of surgeons to meet cataract surgical demand, Aravind reconceptualized care as a team approach. Those who maintained the instruments, cleaned the operating rooms, and assisted the patients were as important, and their routines as critical to the efficient delivery of operative services as was the surgeon. This team approach dramatically increased efficiencies in the number of patients who could be operated upon while reducing costs still further. There were still residual costs. To cover the residual costs, which were still an impediment to those most needy, Aravind twinned patient populations. High-quality outcomes attracted wealthy, paying patients, whose payments in turn subsidized the same care provided to the poor. Surgeons and surgical outcomes were identical in both populations, but 30% of the patients paid full costs, while 70% paid little, if anything. This has proved to be an effective and sustainable business model. From their original 11-bed clinic, Aravind has expanded to 5 hospitals across southern India, performing over 300,000 sight-restoring operations every year. They have trained surgical teams and managers from across India and Asia at large, and are now expanding their impact to Africa. The Aravind Eye Care System now manufactures a wide range of sutures, needles, and intraocular lenses at low cost for eye care programs around the world. It has an expansive ophthalmic training program that contributes to the local manpower needs of many developing countries and delivers a wide range of didactic courses and programs dealing with the prevention of visual impairment and blindness. Now in its third generation of leadership, Aravind has demonstrated that its model for delivering eye care to poor populations is both effective and sustainable. For its innovative and sustainable approach to blindness prevention, the 2007 Champalimaud Vision Award is presented to the Aravind Eye Care System.